Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you today. Micronutrients to affect outcomes of COVID-19 in patients. Lifestyle or nutritional status of patients with COVID-19 partly predicts the pattern of disease progression and even the expected outcomes. The symptoms among corona-infected patients varies because of various unknown mechanisms. Now, few clinical studies have paid attention to the role of micronutrients in the disease's course and how it may affect the disease outcomes. Micronutrients, however, as we know it, has a noticeable effect on the host immune system regulation, and a review in Human Nutrition and Metabolism journal reported optimal micronutrition supports and contributes to the efficiency of the COVID-19 vaccine. The review highlighted the role of different micronutrients in the management of COVID-19 and optimizing vaccines and to relive the clinical effects of micronutrients deficiencies in patients with such a condition. Anterior cruciate ligament surgery effect with prehabilitation. A successful anterior cruciate ligament reconstruction surgery and rehabilitation is characterized by patient satisfaction, knee stability, and always the happiness to return to sport while also preventing re-rupture. Failure occurs in 5 to 25% of patients when one considers both graft ruptures and ongoing laxity. The challenge of going through a revision surgical procedure because of one of these adverse outcomes is definitely a concern. Prehabilitation prior to anterior cruciate ligament reconstruction should include quadriceps strengthening, improving the range of motion and a balance, and proprioception as a minimum according to a study in rehabilitation and return to sports in athletes. The exercise before surgery might reduce the odds of surgery overall. Effects of masks and disinfectant in migraine patients during pandemic. COVID-19 has caused adverse effects in every organ system whose complications are upcoming day by day. Considering that migraine is one of the 5 most disably causing diseases in the world, it is essential to clarify the interaction between migraine and the COVID-19 pandemic. The study in the journal Clinical Neuroscience says worsening of migraines is more than half of patients during the COVID-19 pandemic. They demonstrated a relationship between migraine worsening and mask type, number of masks, and intensive disinfectant use. Migraine patients should be advised of optimal prevention methods based on individual, social, and working conditions rather than exaggerated preventative measures. Gamma knife radiosurgery for the management of residual high-grade gliomas. Tumors in the brain are difficult to manage, with end result being death. The most common and aggressive primary adult brain malignancy is high-grade glioma. High-grade gliomas are presently managed via surgical resection, external beam radiation therapy, and even chemotherapy. Although gamma knife radiosurgery is currently used to manage high-grade cases, it is not being considered a standard care. A paper in the Journal of Clinical Neuroscience states gamma knife radiosurgery applied to residual tumors during the early post-operative period in high-grade gliomas can contribute to a higher survival overall with less additional morbidity. Therefore, gamma knife radiosurgery can be added to the current management practices for treating residual high-grade gliomas. Sarcopenia to affect patients with multiple sclerosis. Multiple sclerosis, an immune-mediated neurodegenerative disease characterized by the presence of demyelinating plaques in the central nervous system. Management is a bigger challenge, however. The relationship between sarcopenia and multiple sclerosis has not yet been investigated. This study in multiple sclerosis and related disorders aims to determine the prevalence of sarcopenia in multiple sclerosis patients and further investigate the factors associated with the development of sarcopenia. They detected the approximately 1/5 of multiple sclerosis patients have sarcopenia. Regional sarcopenia was more prevalent than whole body sarcopenia, and they found a high degree of fatigue and lack of exercise in sarcopenic multiple sclerosis patients. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.